Hello and welcome. You're watching Health and Wellness, Save a Life. I'm Gargi Rawat. When a medical emergency like a cardiac arrest happens around a person, it's important to be prepared. You can help someone in a medical emergency only when you're clear as to what is to be done in such a situation. If you're aware and informed, then you take steps to revive a person and save his or her life. Recently, Raju Srivastava passed away after a prolonged health battle following a heart attack at his gym, and we have lost many other celebrities in the past 2 years to heart attacks. As a result, heart health becomes more of a concern. Worldwide, millions of people die of sudden cardiac arrest every year. This is partly due to limited and sometimes ineffective bystander cardiopulmonary resuscitation. Many adults in cardiac arrest can actually be revived with intact neurological function if the bystanders provide immediate CPR, and that's if they know how to perform it. Raising public awareness and understanding of the practical applications of CPR is an essential strategy to increase CPR success in cardiac arrest cases. Save a Life is an initiative through which people will be made aware of early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We're joined by Dr. Nitin Gudage, consultant and interventional cardiologist, Gudage Hospital, Bidar, Dr. Nimit Shah, consultant interventional cardiologist, HN Reliance Hospital, Mumbai, and Dr. Shadab Samad, consultant and HOD cardiology, GS Medical College and Hospital, Hapur. Thank you so much, doctors, for joining us on the program today and answering all our questions and, creating more awareness about this issue. Dr. Shah, I'd like to start with you. Sadly, it's become very common that younger and fitter people are now succumbing to sudden heart attack. What is the reason for this?
This is a very good question. If you look at the recent data, it would be very naive to believe that heart attacks or heart-related issues are restricted only to older populations. In fact, cardiologists across the country are finding increasing number of heart disease in young population. And this phenomena is termed as premature heart attack. And as you rightly said, recently a lot of well-known celebrities have succumbed to this heart disease. And the cause of this is multifactorial. If you look at, there has been disruptive daily routines of young population, which is the prime reason for such premature heart attacks. Late night working hours, increased stress levels, smoking and sedentary lifestyle plays a huge role in escalating of these heart-related issues. There are several other reasons which lead to the rise in heart attack, especially among Indian patients, because primarily India has a high incidence rate of diabetes and hypertension, which are two leading causes of heart disease. And last but not the least, in last 2 years, COVID-19 has played a major impact on heart health. Increasing tendency of clot formation in the blood vessel due to COVID-19 infection has led to several cardiac issues. In fact, second wave of COVID-19 has led to a surge in this high-risk patients with heart-related ailments, especially post-recovery.
All right, so an important point, and especially to have this awareness post-pandemic, the risks have increased. Dr. Samad, can sudden cardiac death in young people be prevented? Are there any early signs or symptoms which people may pay attention so that they can take steps to prevent a sudden heart attack?
Good afternoon, everybody. First of all, I need to congratulate NDTV for this great initiative. This is very concerning. These days, we are seeing a more and more kind of sudden cardiac deaths among the young people. And although, as the name suggests, it cannot be predicted 100% when it's going to happen. But yes, there are some risk factors and there are some clinical profiles so that we can predict the occurrence of high risk in a patient. So if you see the Indian scenario, we have more coronary artery diseases, which are mainly culprit behind these sudden cardiac deaths, especially among the young patients. So, looking at this risk profile of coronary artery disease, like somebody is having diabetes, hypertension, obesity, excessive smoking, excessive alcohol intake, and also the sedentary lifestyle and more importantly, the amount of stress and erratic lifestyle we are living in India at the moment. So if we are looking at it, if somebody is diabetic, one should be having proper sugar control. If somebody is not diabetes but having a strong family history, so at that time, in that scenario, we need to get the regular checkup to get it diagnosed as early as possible. Maintaining a good sugar level, maintaining ideal weight, and cutting down smoking altogether, which is very important, and decreasing the alcohol intake. These are the things, and looking at the signs and symptoms. If somebody is having any kind of chest pain or discomfort, which is increasing on exertion, and associated with any kind of diaphoresis, or commonly said ghabrahat, and we need to go visit the cardiologist as soon as possible to get it diagnosed, especially if somebody is having a strong family history of sudden cardiac death. In that scenario, somebody might be having congenital arrhythmia syndromes and congenital cardiomyopathies, which need to be diagnosed as early as possible to prevent, and the corrective treatment should be taken as early as possible.
All right, Dr. Gudage, there's been information circulating on social media claiming that a person who's alone can avoid cardiac arrest by coughing, coughing hard to prevent the condition from worsening. Is this correct, and is this advisable?
Definitely, vigorous coughing will not save you during an arrest or heart attack. And there is clearly no data evidence supporting that coughing has got any relationship with the preventing a cardiac arrest. Basically what happens in a cardiac arrest is the heart stops suddenly without warning. So patient who has got cardiac arrest cannot cough. So definitely this is a myth. And some of the few of the prenormal symptoms, like patient can have a cardiac arrest, like they will have some discomfort in the chest, any uneasiness, any discomfort, dizziness. And I think what a person can do is can go to the nearest healthcare center or healthcare provider, and this will definitely save a life. And this is definitely a myth that when the person who is alone and coughing can prevent a cardiac arrest.
All right, so it is a myth, so it's important to to clarify that. Dr. Shah, what is the first thing you should do when you see someone going into sudden cardiac arrest?
Again, a very relevant question. I would summarize this as a D, R, and S. So what does D means? D means danger. When you see a patient with a cardiac arrest, you have to make sure the area is safe for yourself, for others, and the patient. Patient is not on a high ceiling, not where he's going to fall. There's no fire around. You have to make sure the D. Then the response. Check if the patient is conscious or unconscious. If the patient appears unconscious, you have to tap and shake him and ask very loudly, "Are you okay?" If the patient does not respond, then call for help. If the patient responds, make him comfortable, check for injuries, and monitor the response. And the S means send for help. So if you are dealing with the patient, ask someone else to call the ambulance or ask to make a call for some help. So these are important, D, R, and S.
All right, Dr. Samad, what are some of the important points to remember when you're performing hands-only CPR?
The hands-only CPR is, resides on the strategy of pushing out the remaining amount of oxygen throughout the body to prevent the vitals organ failing. Okay, we know most of the, as per data suggests, most of the deaths occur at home. So you probably are facing this kind of catastrophe among your near and dear ones. So first of all, don't panic. Think rational. Call for help first. Call on any emergency number available to you or any nearby hospital or healthcare provider. And after that, you start CPR. The CPR is a hands-only CPR. So there are again two strategies: the push hard and push fast. This is very important. The CPR should be started immediately because every minute losing means you are decreasing the chance of survival of patient. So when we start the CPR, the correct hand positioning and the correct amount of rate to be applied is important. First, we need to put our hands in the center of chest. You need to come over the patient with shoulder, with knee interlocked, so that your arms should remain straight. You need to put your palm over the center of chest. Put other hand on the hand, and keep your fingers interlaced. Then you need to push hard, so that at least it should go down by the 2 inches or at least 5 centimeter. The correct rate is important. The rate should be around 100 to 120 minutes per day, per minute. If it goes by the 100 to 120 per minute, that means sufficient amount of oxygen or blood is being pumped out of the body to save the vital organs. One thing which is important, to minimize the interruption between the chest compressions. You need to decrease the interruption as less than 10 seconds. And if you are tired, and you continue CPR till the helper arrive, or if there is fatigue, you need to change the rescuer. So pushing hard and pushing fast with a good amount of force, and at least 100 to 120 minutes per day. That's actually important, and that might amount to saving a life.
All right, so important points to keep in mind when performing hands-only CPR. Dr. Gudage, when performing CPR, how does a person know if it's even working?
See, CPR is not just, whenever the word comes to CPR, the first thing comes to mind is mouth-to-mouth breathing. The guidelines have been shifted from, previously it was airway, breathing, circulation. Now the guidelines have been changed from ABC to CAB, where the first comes circulation, airway and breathing. So as I told, the circulation, to have the improved circulation, first is to give the chest compression. It is around 100 to 120 chest compressions per minute the individual has to perform on the suffering of the cardiac arrest patient. And how do we know whether our chest compression are successfully helping the patient or not, is to know by the carotid pulse, which is over here, and we have to look by the chest compression whether any pulse you are feeling or not. And this basically, the chest compression improves the circulated oxygenated blood, and it helps to buy the time, so that any healthcare provider or any nearest emergency services can be available at the spot. So I think continuing the administrating CPR, it will definitely help. And now more of chest compression, the one who can know is only by looking for the carotid pulse.
All right, so that's important to keep in mind to know whether the CPR one is performing is working or not. Dr. Shah, it's generally believed that CPR should be performed for every unconscious person. Now, is this true? When should one not perform CPR?
Again, when I did inform that once you see the patient has collapsed, you have to make sure whether he's conscious or unconscious. You shake him hard and say, "Are you okay?" You perform CPR only if the patient is unconscious and you cannot feel the pulse and the patient is not breathing. If it's very difficult to feel the pulse if the blood pressure is low. As my colleague said, you feel the pulse in the carotid. If the carotid pulsations are quite prominent, then you don't have to perform a CPR. If you make sure your patient is completely listless, not responding at all, there's no pulse, then you look whether the patient is breathing or not. So you just put your face near his chest and feel whether you can feel any breathing or air in your face when you keep your face near his chest. If there's no breathing, there's no pulse, and patient is unconscious, you start CPR. But if the patient is conscious, when you move him, he does respond, you don't have to perform a CPR. Then you look at other parameters, what led to his collapse, whether there are any injuries, and you have to rush him directly to the hospital where they would be assessing him to whether his blood sugars were down, whether he's having a heart attack, but still not got a cardiac arrest, or there are any other issues. So if the patient is conscious, he does have a pulse, you don't have to perform a CPR.
All right. We have a lot more questions for our doctors. We'll slip into a short break and return with more. Stay with us. Welcome back. You're watching Health and Wellness, and we're discussing how to save a life and how it's important to know CPR. Let's go back to our doctors and ask them about CPR and its role. Dr. Samad, what are the chances of survival after giving CPR? Is it immediate? Does CPR always work?
Unfortunately, no. The CPR does not work always, but this gives a very good chance to save a life. As per CDC, 9 out of 10 die in case of out of hospital cardiac arrest, and the average survival is around 10 to 15% till the discharge. Looking at the fact that 7 out of 10 cardiac arrest occurs at home, and you might be witnessing this cardiac arrest with your near and dear ones, with your close relatives. It may be unknown. Every life is precious. So even there are less chance, even there are not very 100% chance to save life with the CPR. But as every life is precious, every beat is important. So we should do CPR to give a chance for survival. I think we should give a chance for sure, because every life is precious.
That's right. Dr. Gudage, lack of CPR awareness is a big health challenge in India. So please tell our viewers, why is it essential for people to learn CPR?
By learning CPR, you are going to prevent the situation from getting from bad to worse. In some situations, if a patient doesn't receive basic CPR, the patient condition is going to worsen and the patient will die immediately. And by being able to provide CPR, you can stabilize the patient. Basically, it helps to buy the time until any healthcare provider or any emergency, any ambulance come to the site where the person has suffered a cardiac arrest. Basically, CPR mechanism is by providing the chest compressions, it improves the circulated oxygenated blood to the body. So it helps to basically buy the time. And instead of doing nothing, you can perform CPR efficiently and save someone's life. And I feel literally every member of the family should know how to perform CPR. And there is no happiness in the world other than saving someone's life. I think every one of us should know how to perform CPR efficiently.
All right, so it's important to learn, especially since, so many people suffer from heart disease, and in every family there's at least one person who does have some issue. Dr. Shah, can a person live a normal life after cardiac arrest survival?
Again, a good question. It all depends the cause of the CPR, how soon the CPR was given. The cause of the cardiac arrest and how soon the CPR was given. As my colleague said, there are just chances of survival is 10%, patient getting discharged from the hospital. Whether CPR was given at home, on road, or patient was brought after the cardiac arrest into the hospital and then the CPR, it's a good data, and there's a lot of evidence from American Heart Association and a lot of published data. If there's an out of hospital cardiac arrest and the CPR is given by bystander, the chances of survival are good. As you rightly mentioned, there's quite a lot of lack of awareness in India about the CPR. And in fact, in Mumbai, we have good initiative, especially with my colleague, senior colleague, Dr. Yash Lokhandwala, who is taking a lot of initiative in training, people at bystanders giving CPR. If the CPR is given quickly and the patient recovers immediately within 5-10 minutes, the chances of survival and good normal life is feasible. And as I said, what is the cause? For example, if the patient had a heart attack and then he has a cardiac arrest, and then we can perform a CPR, and immediate CPR is performed, patient is revived and is immediately taken to the hospital, and the immediate treatment is given, then the chances of survival and normal life increases. But if the CPR is delayed, or if there is a long CPR and the patient survives after 40 minutes or more after the CPR, we don't know what the status of the brain is, what the status of the kidney is, how the heart is going to improve. So it's very difficult to predict. Every case is different. Every person is different. So there's no clear answer for this, whether patient is going to have a normal life, subnormal life, or a dependent life. It's very difficult.
All right. And Dr. Samad, can someone who's already suffered a cardiac arrest then have another one?
That's a very good question. It all depends on the clinical background of patient. Rightly said by Dr. Nimit, cardiac arrest is not a simple condition. Cardiac arrest is not a one condition we are dealing with. We are dealing with whole background of risk factors and medical situations in that body, in that person. Okay, so the reoccurrence is definitely can occur in a person. Depending on the amount of medical therapy or corrective medical therapy a person has taken, the continuation of medical therapy which already advised, or correction of risk factors which are available, which were there in the patient. Looking at the background, if somebody is having diabetes, he's not controlling his diabetes, he's not changing his lifestyle, he's not controlling his blood pressure, dyslipidemia is there, and especially in Indian population, like smoking, continuous smoking, they all give rise to the recurrence of they can give rise to recurrence of cardiac arrest. So we need to see if somebody is surviving from a cardiac arrest. It's a second chance God has given to him, and keeping the low risk risk factor profile, continuing the medical treatment, and taking the complete medical therapy is actually gives you a good chance of living a normal life. So chances of recurrence are definitely there, but it depends on you how you are cutting down the risk factors and continuing the medical therapy.
All right. Thank you so much, doctors, for joining us today and, telling our viewers, answering all these questions about the importance of knowing CPR and how it could help you save a life. Thank you all for watching at home. Goodbye.